Hi everyone, I'm Tom Ryan with Provider Outreach and Education. This video covers the Medicare fraud basics. It's intended to help you identify what fraud is and how to report it. Medicare fraud happens when a person or company intentionally tricks the Medicare program or a beneficiary to get money or benefits they should not receive. The key is intentionally, which means they knew it was wrong and did it anyway. Anyone can commit healthcare fraud. Fraud schemes range from solo ventures to widespread institutional or group activities. Even organized crime groups infiltrated the Medicare program and operate as Medicare providers and suppliers. I'll expand on what the person or entity knows. They are knowingly receiving federal payment for items or services when there is no legal entitlement. They are knowingly soliciting, getting, offering, or paying compensation to induce or reward referrals for items or services paid by the federal healthcare programs. They are knowingly making prohibited referrals for designated health services. Next, I will answer the question, what are examples of Medicare fraud? Upcoding, which is knowingly billing for a service at a higher complexity level than the service provided or documented in the medical record. Knowingly billing for services or supplies not provided, including falsifying records to show items were delivered. Knowingly ordering items or services that the patient doesn't need. Billing Medicare for appointments the patients don't keep. Paying for a federal healthcare program patient referral. Medicare fraud can expose providers to administrative, civil, and criminal liabilities. This may lead to imprisonment, fines, and penalties. People who knowingly make a false claim may be subject to criminal fines up to $250,000, imprisonment for up to 20 years, or both. If the violation results in death, the person may be imprisoned for any term of years or for life. Organizations who knowingly make a false claim may be subject to a criminal fine of up to $500,000. If you suspect Medicare fraud, report it. You may want to pause this slide and note the different ways to report. You may also choose to report to your Medicare Administrative Contractor or MAC. WPS is the MAC for Jurisdiction 5, J5, and Jurisdiction 8, J8. J5 includes the states of Iowa, Kansas, Missouri, Nebraska, and various providers across the nation. J8 includes providers in the states of Indiana and Michigan. If you are not in J5 or J8, visit the CMS website to locate your MAC. There is a link in the description of this video. Remember, Medicare abuse can turn into fraud. Once you know but don't correct the action, it's no longer abuse, it's fraud. You are intentionally continuing your actions knowing it's not correct. Thanks for taking the time to review the basics of Medicare fraud. That's it for this video. If you found it helpful, like and share it. Don't forget to subscribe to our YouTube channel for more educational videos from us.